potential agapa. Join me for studies. Inhibits metabolism and metabolism. Benzodiazepines. માં IR CR dosing છે. Emotion absence seizure and extra severity produce mechanism highlighting energy effect છે એમાં carbamazepine છે એમાં highlighting energy effect છે minimum enzyme reduction છે hyponatremia, neutropenia, and so ataxia છે dizziness, hypotension અને emotion absence seizure. And last thing છે some side effects, some mild anticholinergic effects. Dysbiosis Hey, what's up? Okay, so hyponatremia asli carbazepine hyponatremia interval is prolonged peer interval prolongation in rash, endoscopy metabolism, and 3F1 mod 3-4 સાથે moderate કરે છે અને 2C19 B2C19 inhibitor છે. Partial seizure, pharmacological succinate derivatives. Psychosis or problems. Levetiracetam should be used in pregnancy. Brivaracetam sublinazines binds to vesicle protein SV2A. Brivaracetam has a higher affinity. CNS and behavioral problems માં આવે. So levetiracetam behavioral problems વધારે છે more than brivaracetam. Rapid titration may be used in pregnancy. Sodium, calcium, and essential એક છે હોર્મોન કોન્ટ્રાસેપ્શન, બીજું કાર્ડિયાક રિઝન છે, અને it may be used in pregnancy. Stimulate. Changes करें open teacher. So it is indicated for generalized seizure and Lennox-Gastaut syndrome. Can cause side effects in some patients. So perampanel અને રોફિનામાઇડ બંને alternative treatment તરીકે યુઝ થાય છે. AMPA glutamate receptor antagonist, CNS behavioral changes થાય. Others, sodium and calcium channel blocker, GABA A, AMPA inhibits carbonic anhydrase. Hypernatremia and cognition banana problem is topiramate. Topiramate causes weight loss and kidney stones cause metabolic acidosis as a factor as well. Acute angle glaucoma and oligohydrosis and paresthesia. Paresthesia and oligohydrosis of metabolic acidosis. Acute angle glaucoma, oligohydrosis and paresthesia. CYP3A4 are the interaction channel. It inhibits CYP3A, reducing 70% renally eliminated. So basically topiramate binds to sodium channel and calcium channel blocker channels, and GABA A, AMPA inhibits carbonic anhydrase. Carbonic anhydrase inhibits the CNS. Word finding: hypernatremia, hyperthermia, cognition problems, effective cognitive acts, limited use. So AED now first line monotherapist કઈ કઈ છે તો carbamazepine side effects are hepatotoxicity, anticholinergic, neutropenia, and hypernatremia. Lamotrigine causes SJS, decreased connection by carbamazepine and similar efficacy. Phenytoin can cause gingival hyperplasia, fluid deficiency, and increased body hair, which is hirsutism. What if the psychiatric disorder present? Safe options in pregnancy and generalized seizure. So levetiracetam is a safe in pregnancy, and tonic-clonic seizure, milder common adverse effect other than AED. Avoiding liver pancreatic disease, pregnancy, and of childbearing age. Liver and pancreatic disease, pregnancy, woman in childbearing age, partial seizure. So carbamazepine, hepatotoxicity, anticholinergic, neutropenia, and hypernatremia causes partial seizure, but better options available. Lamotrigine, SJS, efficacy, barabar. So carbamazepine, partial seizure, but better option available છે. carbamazepine કરતા partial seizure માં options are oxcarbazepine and 3Ls, levetiracetam, lamotrigine, lacosamide. Lamotrigine SGS cause करे decrease concentration when COC better tolerated than carbamazepine करता better tolerated चैन है similar efficacy. Partial seizure lamotrigine जैसे atonic and clonic seizure में यूज़ है. Gingival hyperplasia, folate deficiency, increased body hair, wherein if other options are available due to many adverse effects and complications. So, valproic acid has to be avoided in liver and pancreatic disease. Liver and pancreatic disease मैंने avoid करवाना. Tonic, maclonic and tonic-clonic seizure बनना. Management takes pregnancy. Lamotrigine levels may decrease variably during the second and third trimester of pregnancy. Recommended to refer the patient to the healthcare provider for monthly monitoring and registration with North American Anti-Epileptic Drug Pregnancy Registry. Therapeutic drug monitoring is necessary to account for serum fluctuations and ensure patients remain seizure-free through the pregnancy. Lamotrigine levels are rise quickly after delivery, 1 to 2 weeks thus. So after delivery, the level of lamotrigine rises pretty quickly within 1 to 2 weeks, so dose must be adjusted early after delivery to avoid toxicity in patients. Lamotrigine level during pregnancy, we have to increase the dose, and once the pregnancy after postpartum, the dose has to be reduced after 1 to 2 weeks. Topidamab, oxcarbazepine, lacosamide, levetiracetam level may also reduce during pregnancy. Monitoring required. Enzyme induction AEDs may increase fetal vitamin K degradation. Vitamin K degradation in fetus. This vitamin K is routinely administered to newborns after delivery to prevent hemorrhagic disease. So basically, fetus na vitamin K supplement upon a patient should take at least 1 milligram of folic acid from preconception until the end of the first trimester. Then they can switch to 0.4 1 milligram folic acid preconception until the end of the first trimester, and then we can switch to 0.4 milligram per day to prevent irreversible defects. The drug of choice should ultimately be the drug that best controls seizure and pregnancy. Avoid valproic acid, phenobarbital, and perampanel. So अपनी main choice है topiramate oxcarbazepine level, lacosamide level may also reduce during pregnancy. Moderate enzyme induction AED may be increased fetal vitamin K degradation. Thus, take at least 1 milligram of folic acid from preconception. So during pregnancy, carbamazepine, phenytoin, valproic acid, and lamotrigine. Carbamazepine, phenytoin, valproic acid, and lamotrigine are likely safe. Breastfeeding should not be discouraged. Clinical significance of AD transfer into the breast milk is unclear. So during breastfeeding should be discouraged. AD monitoring infant is not routinely performed but can BMT test has to be done after 5 years of taking AEDs and before starting AED. So basically calcium and vitamin D supplements upon a so AEDs are typically used lifelong, but if the patient is symptoms free for 2 or more years on stable dose of AED, normal neurological exam and normal EEG factors associated with poor prognosis are history of high frequency of seizure, multiple episodes of status epilepticus, multiple episode high frequency, combination of seizure types and development of abnormal mental functioning. So factors that are associated with poor prognosis are the high frequency of seizures, multiple episodes, combination of seizure types, and development of abnormal mental functioning. So takeaway: select a single AD on based of seizure type. AD polytherapy for patients who fail to achieve acceptable control on 2 to 3 monotherapy. So polytherapy ત્યારે યુઝ થઈ જ્યારે 2 to 3 monotherapies are failed, and EDs have numerous drug interactions, and patient education is the key. Oral contraceptives decrease levels of lamotrigine, phenytoin, carbamazepine decrease level of oral contraceptive. Phenytoin dosing equals to saturation kinetics. Maintaining the serum level with the therapeutic range is not priority. It is important to treat the patient, not the serum level. So take the patient, that's the goal, not the serum level. In pregnancy and breastfeeding, the drug of choice should be ultimately drug that best control seizures. So basically during pregnancy, lamotrigine level નીચે આવશે, carbamazepine level પણ નીચે આવશે. Complete a BMD test after 5 years of AED use and before starting AED in postmenopausal women. Before starting AED in postmenopausal women. AED use typically lifelong. Somebody is 34-year-old female that has been discouraged from the hospital after experiencing a seizure. advice about seizure medication. The notes from the hospital says SE had a 90-second seizure that involves bilateral jerking movements. 90 seconds, no seizure. And bilateral jerking movements, episodes of incontinence. She has no recollection of this after the seizure. She was groggy and tired. So the first episode of seizure, the blood pressure is 120/77. Heart rate is 74, blood pressure 128/77, and BMI is 30.3 kg. Hypertension है, obesity है, amlodipine, levonorgestrel, ethinyl estradiol, 17 milligram oral daily. She does not smoke, she drinks alcohol. The type of the seizure is absence, Granville. It's a grand tonic-clonic seizure because it lasted more than 90 seconds. So the medication are the most appropriate to start on. So अपनी बेस चॉइस है Granville clonic seizure is levetiracetam. Sorry, sulfuric acid. Sulfuric acid causes weight gain. Causes hepatotoxicity. So during pregnancy, we cannot give phenytoin, valproic acid. Levetiracetam is the first choice. She was not prescribed ED on discharge as it was likely a provoked seizure. As per the medical team, which of the following is not possible contributor to the provoked seizure? Blood glucose level immediately post seizure was 2.4, so that's a red flag. She had 8 drinks of alcohol during the presentation. Admission blood work revealed a serum concentration of 349 micromole per liter due to the severe dehydration. On presentation, the blood pressure is 128/72, so that is not a risk factor. Admission blood work reveals serum creatinine, so creatinine is really high. 8 drinks of alcohol on the day of presentation. Alcohol causes seizure. So 1, 2, 3, done. Blood pressure.